Okay, so this is CPR first aid, and this is the CPR scenarios that I'm kind of running through a little bit more today. So in this one, it starts with rescuer 2 is always going to be the person who goes towards the CPR mannequin first. So that person is going to be in charge of initiating CPR in each of those different scenarios. Rescuer 1 will always start with the first aid scenario and then come and be the assistant on the CPR after their patient is stabilized. So rescuer 2 on this one, this is skill 6, is going to initiate adult basic life support, CPR. Remember that currently, so I'll redo these videos next year. This is January 2021. We're going into our state leadership conference that's going to be virtual. And in this one, we are using the old BLS guidelines. So they're about to switch over this winter with some new guidelines. And so this is following the old ones. So just make sure that you know that you're following the rubric. If you've learned something in a more recent CPR class this spring, that's been a little bit different as far as what we're looking for or what's happening there. So rescuer 2 is going to come and verify that the scene is safe to begin with. Open up your first aid kit that maybe you're sharing with your partner, that you're responsible for having and putting together. And you are going to put on your personal protective equipment and verbalize that. You're going to then come to your patient and see if they are responsive. So you can tap on the shoulder gently here and are you okay? And the judge will then voice things to you such as the patient does not respond. So you'll get that feedback as you're rolling to that. You're going to shout to your partner then to activate the emergency response system and get you the AED. In this scenario that we're working through right now, the AED is not available. And so as I then go on this, I'm going to check for breathing and check for a pulse. I like to do those at the same time, so you can check for a carotid pulse here on their throat. I like to put my hand and feel for breathing, feel with a little bit with my cheek at the same time. And I want to verbalize that I would be using 2 fingers. I'm sliding it into that groove of the trachea. Judge knows that you know where to check those kind of things. And that I'm checking for no less than 5 seconds and no more than 10 seconds. Again, the more you can verbalize things for the judge so that they know that you know what you're talking about and you follow those rubrics, the easier it is to give you those points, especially when it's hard to kind of see where you're at. So just verbalizing exactly where you're sticking those fingers, how many fingers you're using. Everything should be verbalized as you're moving through these, and that'll help you score better. So because of that, no breathing, or not breathing normally, like an agonal respiration, which would look something like just a we call that agonal respirations, and they have no pulse. This is a patient that we would initiate CPR on. So the current BLS standards that we're working on right now for your written test and for your practical that you would be to do this with is going to be 30 chest compressions. So again, your mystery scenario is going to come out to show us that you have this skill. We might still have you show us that you can do it using a pillow or using something if you don't have a CPR mannequin. In the future, this is a style of mannequins that we're going to be using. And this guy's nice because he lights up. So you can kind of see those buttons there on this top right in here that light up, and it'll tell you 2 greens are what you're looking for, that you're at the right depth and the right ratios. Red a lot of times will show up blinking if you're not going deep enough on your patient, or a lot of my students might be going too fast, and that won't allow for full recoil. And we need that recoil for that heart to fill up with blood. If we don't let it fill up, we're not doing a lot of good. And so this allows us to check the effectiveness of our CPR, which is going to be important in a scenario like this. And we have those capabilities at an in-person state leadership conference. And obviously we're going virtual this year, so you're not going to see that. But I want you to kind of be aware, if you're thinking about this event for next year, you're trying it on for size this year, kind of seeing what's going on, or you're seeing this video in the interim. Maybe you're watching this and thinking about next year and it's summertime or it's early fall and we haven't updated the new standards yet. Just kind of know that those will change a little bit with the new guidelines and, a virtual versus an in-person state leadership conference. So I'm going to position myself for proper CPR on my patient's side. Realistically, the table that I'm working at right now is too tall for me. Your patient in this scenario would be on the floor. In real life, we want to work on a solid surface and not like a bouncing bed and that kind of thing. So getting down to the floor, kneeling beside your patient is really where you want to be. For this, you're going to verbalize that you're at your patient's side. my patient's face up on a flat, firm surface. Again, I'm verbalizing that so I can get those points on that rubric if you want to follow along, either on the Montana Short Sheet Guidelines or the guidelines from National HOSA. And then I'm going to use the heel of my hand, okay, this part here, and I'm going to be putting that on the breastbone or the sternum, on that lower half, but not on that xiphoid process. So your xiphoid process, okay, is where this comes together and you have that lower end of your sternum. We don't want to put our hands on that. So we want to be up more in this area here on this lower part of that sternum, but not on that xiphoid process. And again, then I can lay my other hand on top of that first palm. And the goal is not to be using your arms. Sometimes I see students in there, this is exhausting. CPR is exhausting enough without having to rely on arm strength. You want to use your body weight to have that compression. So I'm leaning over and using my body weight while my arms stay stiff. Is going to be the easiest way to do that and the most effective way to do that. So again, on your rubric, it talks about with arms straight, my shoulders directly over. I'm getting to my body weight. I'm not here. I don't know if you can see that angle-wise. Sometimes you're too far out and you're not getting your full body weight as if you are up close and my shoulders are in line with that chest. So if you're having a hard time getting your mannequin to click or trying to get that effectiveness for 30 compressions, especially for a lot in a row, you're doing 2 minutes, 5 minutes of CPR, that kind of thing, getting that body weight over there is going to help. So again, you're going to do 30 compressions at that proper rate in there. And after 30 compressions, we give 2 breaths. Again, we want to make sure COVID times and non-COVID times that we're really looking out for personal safety. You would be responsible for bringing your own mask with a filter. We'd be wiping these masks down again, or the mannequins down, maybe changing out the lungs. Because again, right now in COVID times, we're not actually doing mouth to mask with the mannequins when we're teaching CPR. I don't know what that'll look like a year from now if we were to go back to an in-person state leadership conference, but know that we'd be taking proper precautions. Right now with it being virtual, I just want you to understand how this works and what this looks like. But this is a mouth to mask device. And then these filters sometimes pop out depending on how yours is created. But it has a filter in there which just kind of prevents us from breathing the same air as each other, me and my patient here. And then I'm going to seal this on my patient's face. So again, it has a narrow side and then a wide side. This is going to go over your patient's bridge of their nose, okay, for good positioning. I like to, just kind of as a little tip, I like to pull this inflated part back a little bit. It helps me, especially when I'm using the bag valve mask that I'm going to show you later, get a really nice seal on there. And then with my hand on this side, I'm going to do a head tilt chin lift. So I'm going to hold this side down. I like to kind of use a C clamp and press and hold and tilt that head. That's going to open up your patient's airway. And then again, fingers always stay on hard plastic. When you move to that softer plastic, I find I don't get as good of a seal. It's kind of counterintuitive. When you feel it leaking, you intuitively want to move your fingers onto that spot where you feel that leak. But you know, physics-wise, if you keep your fingers on the hard plastic, it'll evenly distribute that air in that air pocket. So again, I kind of use 2 fingers on top, pressing down, and then my other ones, I'm kind of doing a head tilt chin lift and lifting that chin. In there again, you can verbalize those steps, and you're going to go ahead and do 2 breaths. So again, right now, we would just be verbalizing that in a COVID world when I'm checking your videos that you would know how to do that. These things will have chests that rise, that we're going to confirm that those airs goes in to their chest, and that it goes in nice and over 1 second. I don't want to and just kind of puff their lungs up. I want to breathe that in nice and slow. I'm going to continue doing this. 30 compressions, 2 breaths. 30 compressions, 2 breaths until my second rescuer comes over. Rescuer number 1 is how they're titled on the sheet, to help me. So again, in real life, I would continue this again until I had help, or until I was too exhausted to continue. And so at this point, the other rescuer would come over. Because I'm tired, because I've been doing compressions for however long it took them to take care of their first aid patient, I'm probably pretty smoked. So I'm going to take over at the head of my patient and allow them to do compressions, because they're a little more rested and more likely to do effective compressions. So they're going to come over, and out of your first aid kit, you're responsible for bringing a bag valve mask. This is what this looks like. Okay, it has a hose that we connect to oxygen. In the medical world, in this scenario, you're not connecting to oxygen. We still have plenty of oxygen in the air that we breathe every day, so we don't always have to connect this. We can still ventilate our patient and give them room oxygen by using this. So your mask, you can either have a separate mask that's on there, or your other mask will pop onto this. And so now you're in charge of this. And what I see is sometimes students, they just get in this habit of wanting to stay on the side of their patient. One, you're kind of in the way of your partner. Maybe they're on that side. But the easiest way to do this is to be at the patient's head. So obviously you're not going to just switch your patient like that. You're going to walk around to the head of your patient. And you're going to use a proper CE clamp technique. And so again, we do that head tilt chin lift where we're opening up their airway. And then I'm doing a C and an E. C, E. And so my C is pressing down on that plastic like I was showing you before. And the E is pulling up on their chin for that head tilt chin lift. This is hard to do. It looks really easy. It looks easy on TV. It looks easy on your videos. If you have a CPR mannequin at your school, I highly suggest it's a skill that you practice, especially as girls with our smaller hands. That muscle memory, just kind of trying to get that strength of getting a good seal there is a lot more difficult than it looks, and it's something you're going to want to practice. Even squeezing then the bag itself can be difficult. This patient here is fairly healthy and has good lungs, but again, if your patient has swollen lung tissue and things, it's going to be harder to force that air in and harder to squeeze. So again, things I do to make it easier for myself is I pull this back first to get a good seal. I would be at the head of my patient. I'm going to CE, and then again, I want to squeeze this bag over 1 second and try to get the whole volume to squeeze. If I'm kneeling there, sometimes I'll use both my hand and my leg to kind of press into to help me squeeze if I'm having a hard time squeezing that. Just kind of some tips for you. And so again, we go through and they're doing 30 compressions. They should be counting out loud so that I know that 28, 29, 30. I give 2 breaths. And we would go ahead and continue that. And then the typical time to switch is after 5 rounds. So 30 to 2 is 1 round. 30 to 2 is 2 rounds. And you're going to go through and do 5 rounds. And typically that's about 2 minutes. If you had an AED present, it would count out and tell you when it's going to analyze. And that's going to be the best time, again, to switch. And so you would go ahead and switch after 5 rounds. You want to, kind of dance around each other, that you're not kind of running into each other, maybe saying, okay, I'm going to move this way, and you're moving that way, and it's a nice coordinated effort. Now I'm coming back to doing those compressions that I was doing before, and my partner needs to know how to work this bag valve mask because they're going to move to the head. At this point, once we've done a set together, 30, where I'm showing my compressions, they're showing that they can work this bag valve mask, the judge would let you know that EMS has arrived and is taking over. And then they're going to score you again on things like, did you have good communication with your patient and your partner? Did you use good PPE? Did you dispose of your PPE and discard it properly as far as how we take those gloves off and do that kind of thing? But that would be your role as Rescuer 2 initiating this. Rescuer 1 has his or her own score sheet as they come over to help you. And so as they come over to help you, one of the first things that they should do after coming from their first aid patient to your new patient is changing their gloves out, okay, so that we don't have cross-contamination of PPE. So now we're into skill 7, because these go together, where Rescuer 1's assisting. Like I said, they're coming over and starting at the chest compression. The rubric stays the same. How do I do that? What does that look like with the hand and the palm and the sternum? Are they using good CE technique when they come to the bag? So it's the same skills that I was teaching you, but just kind of show what that rubric looks like for being able to do both of that. So both rescuers need to know how to do CPR. Rescuer 1 also needs to know how to do first aid, but both people need to know how to do CPR. Rescuer 2 needs to know how to do solo CPR and 2 rescuer CPR, whereas the other person is just going to come and do a 2-person scenario. So again, that's skills 6 and 7 for adult basic life support.